The traumatized cub who bit through. Reinforced medical gloves was purring in. The human's arms within 6 minutes. Let me back up because you're going to think I'm exaggerating. I'm not. I've been medical director of Station Havros for 11 cycles, and I have 3 advanced degrees in Xenom medicine. I've treated over 40 different species. I've handled chemical burns that melted through containment fields, parasitic infections that rewrote their hosts, genetic code, and one memorable incident involving a diplomat who'd accidentally fermented in his own ceremonial attire. Nothing, and I mean nothing, prepared me for that human wedding planner and what she did to every protocol I'd ever written. The cub came in on a security transport at ZO 400 hours. Vex Mill, our security chief, had led the raid personally. They'd found him in a cargo container on the lower decks, along with evidence of a smuggling ring that had been using him for what the reports clinically called systematic abuse conditioning for underground fighting circuits. He was maybe 4 cycles old, a Crevati, one of the predator species from the outer reaches, quadrupedal, covered in matted gray fur, with fangs designed to punch through whole plating and claws that could file a grown Terran in under 3 seconds. He'd used those claws on 2 of Vex Mill's officers during extraction. They were in surgery when the cub arrived in my medical bay. I'd prepared the trauma suite. Karan, my best pediatric specialist, had assembled a team of 6. We had sedatives, restraint fields, the works, standard protocol for traumatized predator youth. The cub took one look at us and started screaming. Not crying, screaming. The sound a Crevati makes when they're about to tear your throat out or die trying. It's a noise that bypasses your higher brain functions and hits you somewhere in the ancient prey animal part of your neural structure that remembers what it's like to be hunted. 3 of my staff backed out of the room immediately. I don't blame them. Evolution is a powerful thing. Karan held her ground. Bless her, she activated the restraint field, the soft kind we use for pediatric cases. Blue light shimmer designed to feel like a gentle hug rather than a cage. The cub bit through it, just opened his jaws and tore through a field that should have been impossible to physically interact with. The generators sparked and died. Secondary restraints, I called out, trying to keep my voice steady. The cub was backing into a corner now, haunches low, lips pulled back from teeth that seemed far too large for his small face. His eyes were wrong, too wide, too empty. I'd seen that look before in patients who'd been broken so thoroughly they'd stopped expecting anything but pain. My team deployed the secondary field. Stronger, tighter, the kind we use for violent criminals. He screamed again and launched himself at it. Blood splattered across the medical bay floor. His own blood from where his claws had torn through the field's edge and into his own paw pads. He didn't seem to notice. Sedative now, Karan ordered. The dart hit him in the shoulder, standard dose for a Creathi juvenile, enough to drop him in 30 seconds. He pulled the dart out with his teeth and kept screaming. Double dose, I said. We hit him with enough tranquilizer to sedate an adult. He wobbled, shook his head, and slashed at the nearest scanner array. Sparks exploded across his matted fur. He scrambled away from them, crashed into a medical cart, and came up with his teeth buried in the supply drawer. That's when I noticed the human. She was standing just inside the Doorway partially hidden behind an equipment locker. Small for her species, wearing civilian clothing stained with what looked like hydraulic fluid, brown skin, dark hair. Pulled back from her face, eyes tracking the cub's every movement with an intensity that made something in my hind drain itch. Who authorized a civilian in my medical bay? I snapped at Vexmel, who'd followed the transport in. She was on the rescue team, Vexmel said. Her fur was ruffled, voice tight with stress. Volunteer translator, she was helping us map the lower deck sections when we found him. Get her out. I tried. She won't leave. I turned to look at the human properly. She wasn't looking at me. Her attention was fixed completely on the cub, who was now attempting to burrow under a surgical unit. Ma'am, I said, using the human honorific I'd learned from cultural briefings, this is an active medical emergency. You need to evacuate to the observation area. She didn't respond, didn't even acknowledge I'd spoken. The cub made another sound, this one lower, wounded. He was favoring his right forelimb, the one he'd torn open on the restraint field. Quran was preparing a third sedative. Director, at this dosage level, we're risking neurological damage, noted. Proceed. The human finally moved one step forward, hands visible at her sides, palms out. Stop, I said. She ignored me. The cub's head whipped toward her, teeth bared. That scream built in his throat again. The human kept walking, slow, steady steps, not directly at him. I noticed, at an angle. Her body turned slightly away. Her gaze lowered. Someone restrain her, I ordered. Vexmel moved to comply, but the human spoke, and her voice stopped everyone. Cold. You're hurting him more. Her voice was quiet, calm, the kind of calm that sounds like the eye of a storm. We're trying to help him, Kieran said, frustration bleeding through her professional tone. You're scaring him to death, the human said. She took another step. The cub tracked her movement but didn't lunge. Look at his pupils. He's not aggressive. He's terrified. He's injured and violent, I said. We need to sedate him for treatment. He's a baby who's been tortured, the human said, and something in her tone made my scales prickle. And you're surrounding him with strangers in a bright room, shooting him with needles and trapping him in cages. How exactly did you think that was going to go? She took another step. She was maybe 3 m from the cub now, close enough that one lunge would put those fangs in her throat. Ma'am, that animal can kill you, I said. He's not an animal, she said. He's a child. The cub made a sound I'd never heard a Krivati make before. High. Questioning. His ears, which had been flat against his skull, twitched forward slightly. The human lowered herself into a crouch, slow, controlled. She was still not looking directly at him. Kate, Vexmel said, apparently they were on first-name basis. Don't. I'm not going to hurt you, Kate said. And it took me a moment to realize she was talking to the cub, not us. I know they're scary. I know it hurts. But nobody here is going to hurt you anymore. The cub's screaming had stopped. He was watching her now, head tilted, body still pressed against the wall, but no longer actively trying to burrow through it. Kate extended one hand, not toward him, but resting on her own knee. Non-threatening. Visible. My name is Kate, she said. I was there when they found you. I saw the box they kept you in. I helped carry you to the ship. The cub's nose was working, scenting her. You remember my smell, don't you? Kate's voice was barely above a whisper. Now, but in the silent medical bay, it carried perfectly. I'm the one who gave you the water in the transport. Quran looked at Vexmil, who nodded. Confirmation. Apparently this had happened. These people want to help you, Kate continued. But they don't understand that you need to know you're safe first. That nobody's going to hurt you, that the cage is gone. She shifted her weight, settling more comfortably into her crouch like she was prepared to stay there for hours if necessary. The cub took one small step toward her. Then another. That's it, Kate murmured. You're okay, you're safe. Now, this is insane, I muttered to Quran. Prepare emergency intervention. For the human or the cub? Quran asked. Both, I thought, but didn't say. Cub was fully out from under the surgical unit now. He moved like he was walking on broken glass, each step careful, testing. His eyes never left Kate's face. She still wasn't looking directly at him. Her gaze was soft, unfocused, directed at the floor. His feet. That's good, she said. You're being so brave. He was less than a meter away now, close enough that I could see the scars under his matted fur, the burns on his paw pads, the way his right ear had been partially torn away. My hands were shaking. I realized I was holding my breath. The cub stretched his neck out, sniffing at Kate's extended hand. She didn't move, didn't react. Then slowly, carefully, he touched his nose to her palm. Kate's eyes closed briefly. When she opened them, I saw something in her expression that made my chest ache. Relief, sorrow, fury. Good boy, she whispered. Such a good boy. The cub made that high questioning sound. Again, he took another step forward and suddenly he was pressed against Kate's legs, his small body trembling. Kate moved for the first time since crouching down, one hand rising slowly, telegraphing every millimeter of movement. She placed it gently on the cub's head, between his ears. He flinched, but he didn't pull away. I've got you, Kate said. Nobody's going to hurt you anymore, I promise. The cub's legs gave out. He collapsed against her and Kate caught him, gathering him into her arms. Like he weighed nothing, he was small for his species, malnourished and stunted, but he still had to mass at least 30 kilos. Kate held him like he was made of spun glass, and then by all the stars in the void, the cub started purring. Not the warning purr of an adult. Creathy, the subsonic rumble that vibrates through ship holes and warns everyone in a 3-deck radius that a predator is near. This was softer, higher. The sound Creathy cubs make when they're safe in their family dens, surrounded by their pack. Kate looked up at us for the first time since approaching him. Tears were streaming down her face. He needs medical attention, she said. Her voice was steady despite the tears. But he needs to feel safe while you do it. Can you work with that? I stared at her, at the human civilian who just done something that should have been biologically impossible. The cub who'd attacked trained medical staff was curled in her arms, purring, his ruined paws resting trustingly against her chest. I said, and found I had no words. Quran, bless her, was more practical. What do you need? A chair, Kate said. And someone who can explain what you're doing before you do it to me in simple terms. I'll translate for him. He doesn't speak standard, Vex pointed out. He speaks body language, Kate said, and tone and safety. That's enough. The cub had his face buried against Kate's shoulder now. His eyes were closing. Purring was getting softer, rhythm, slowing as the 3 doses of sedative finally started to take effect. He's falling asleep, I said stupidly. He's exhausted, Kate said. He's been in fight or flight mode for stars know how long. Now he finally feels safe enough to rest. She shifted him in her arms, adjusting his weight, settling in. Someone get that chair, she said. I'm not moving until he lets me. We got her the chair, a good one with back support, because it became rapidly clear that Kate meant what she said. The cub was deeply asleep now, all 30 kilos of traumatized predator youth dead. Weight in her arms, his claws were extended, tips dug slightly into her clothing, not aggressive, just holding on. I watched Kate's face as she held him. She wasn't looking at us anymore. Her attention was completely focused on the cub, on the rise and fall of his breathing, the flutter of his damaged ear, the way his paws twitched, occasionally in sleep. How I started, then stopped, tried again. How did you know to do that? Kate glanced up at me. In the harsh medical bay lighting, I could see the exhaustion in her face, the streaks where tears had dried on her cheeks. I plan weddings, she said. I waited for elaboration. None came. I'm not seeing the connection, I admitted. Kate's mouth twisted into something that wasn't quite a smile. You ever try to calm down a bride who's having a panic attack because the flowers are wrong, or a groom who's about to bolt because he's terrified, or families who hate each other but have to be in the same room for 6 hours? That's hardly the same as it's exactly the same, Kate interrupted. Somebody's scared, somebody's hurting, somebody's one wrong move away from complete meltdown. You don't fix it by forcing them into compliance. You fix it by making them feel safe first. She looked back down at the cub. Her hand was moving now, slow, gentle strokes along his spine. He sighed in his sleep and burrowed closer. Everything else comes after safety, Kate said quietly. Always. Kate sat motionless in that chair for 3 hours and 14 minutes. I know because I watched the chronometer, convinced that at any moment the cub would wake up and realize he was trusting a species he'd never encountered before. That reality would reassert itself, and proper biology would resume. Reality had other plans. Dr. Curran brought in a portable scanner, the quiet kind that doesn't beep. She explained what she was doing in whispers, showing the device to Kate. First, Kate nodded, murmured something to the sleeping cub, and held still while Curran ran the scan. The results made my stomach drop. 3 healed fractures, improperly set, burns across 60% of his paw pads, malnutrition severe enough to stunt his growth, scarring consistent with electrical shock devices. He's been tortured systematically, Karan said, her voice carefully clinical. For months at least. Kate's hand stilled on the cub's back. How long until we can treat the injuries? He needs surgery on that forelimb. The bone healed crooked. It's impinging on the nerve cluster, but we'd need to sedate him properly, and given his reaction, clears throat. He'll let you, Kate said, when he wakes up. If I'm here, I should have argued. Should have called xenopsychology. Should have followed proper protocols for traumatized predator species. Juveniles should have done a lot of things. Instead, I said, I'll have them prepare the surgical suite. The xenopsychology team arrived at hour 4, 3 specialists, all with more credentials than sense. The lead doctor Thex took one look at Kate and the cub and announced that what we were witnessing was impossible. Kvatha cub's imprint on pack scent. During their first cycle, he explained, like he was teaching remedial xenobiology. This cub has been isolated and abused. His trust responses should be completely shattered. He should be nonverbal, possibly catatonic. He certainly shouldn't be capable of forming attachment to an unknown species. And yet I said, gesturing at Kate. The cub had woken up 20 minutes earlier. He'd opened his eyes, looked at Kate, made that high questioning sound, and she'd murmured something in a language I didn't recognize. Not standard, something else. The cub had relaxed immediately and gone back to sleep. It's a statistical anomaly, Dr. Thex said, likely a stress response, presenting as false attachment. Kate spoke without looking up. Would you like to test that theory? Try to take him from me. Dr. Thex actually moved forward. Vexmill caught his arm. I watched this cub bite through a reinforced restraint field. She said quietly, I'm not interested in scraping you off the floor. The cub stirred, his eyes opened, focusing immediately on Kate's face. She smiled at him. Hey there, she said softly. You're okay. These people are friends. The cub's gaze shifted to me, to Curran, to the xenopsychology team. His body tensed. Kate's hand resumed those slow strokes along his spine. It's okay. They help save you. They want to make you feel better. I held very still. Curran had the sense to take a step back, making herself smaller. The cub watched us for a long moment. Then he looked back at Kate, made a small chirping sound, and relaxed against her again. Remarkable, Dr. X. Breath. She's established herself as interim pack leader, but the mechanism can wait. Curran interrupted. We need to treat his injuries. Kate, can you help us? Kate nodded. Tell me what you need to do. What followed was the strangest medical procedure I've ever supervised. Curran would explain each step in simple terms. Kate would somehow convey the information to the cub through tone, touch, and body language. The cub would allow the treatment, his attention never leaving Kate's face. We cleaned his wounds, applied regenerative gel to the burns, took detailed scans of the improperly healed fractures. The cub whimpered during the painful parts, but he didn't fight. Kate talked him through it, her voice steady and low. You're doing so well, she murmured. Almost done. You're so brave. When we finished, the cub was shaking with exhaustion. Kate gathered him closer. He needs nutrients, Curran said, and surgery within the next 20 hours for that limb. We'll do the surgery, Kate said, but I'm staying with him. That's highly irregular. I don't care, Kate said, and there was steel in her voice. Now, he trusts me. That trust is the only reason any of this worked. I'm not breaking it. She looked at me directly. You want him to survive the surgery. I stay non-negotiable. I thought about protocols, about liability, about every regulation this violated. Then I looked at the cub purring softly against the human's chest. Safe for the first time in months. Curran prepped the surgical suite. I said, Kate will assist. The surgery was scheduled for 0600 hours. Kate refused to leave the cub, so we moved them both to a recovery room with a proper bed. She sat propped against pillows with the cub curled in her lap, dozing fitfully while he slept. I should have gone home, should have filed reports, contacted the oversight committee, done any of the 100 Things medical directors do after a crisis. Instead, I found myself standing outside the recovery room at 200 hours, watching through the observation window as Kate absently stroked the cub's ears while reading something on a data pad Vex Mill had brought her. She hasn't eaten, Coran said, appearing beside me with 2 cups of stimulant. Has anyone offered her food? 3 times. She says she'll eat when he eats. Coran handed me a cup. The Xenosic team is having a breakdown in conference room B. Dr. Thex has written 17 theories and discarded all of them. Good, Kieran snorted softly. You're enjoying this. I'm the medical director of a major station. I have 3 degrees and 20 cycles of experience, and that human wedding planner just invalidated every protocol I've ever written for traumatized juveniles. I sipped the bitter stimulant. So yes, I'm enjoying watching the Xenoi team suffer too. The cub stirred in his sleep. Kate's hand automatically adjusted, finding the spot behind his damaged ear that made him relax. She never looked up from her data pad. How is she doing that? Karan wondered. The intuitive response to his distress. Cues, the perfect calibration of touch. Pressure, the tonal modulation. We spend cycles training trauma specialists in those skills. She plans weddings, I said dryly. Somehow that makes it worse. At Oro 500 hours, Kate finally called. For food, not for herself, she clarified. When the orderly arrived, for the cub. What do Creathi juveniles eat? She asked. Me when I entered the room, processed protein supplemented with mineral compounds, I said. We have standard formula. Does it taste like anything? I blinked. It's nutritionally complete. That's not what I asked. It tastes like medical food, I admitted. Bland, efficient. Kate's expression told me what she thought of that. He's been starved and tortured. The first real meal he gets shouldn't taste like punishment. What would a Crevathi cub eat normally in a family setting? I pulled up the cultural files on my data pad. Raw or lightly cooked meat. Small portions, easy to digest usually. Offered by pack members as a bonding ritual. Can you get some real meat, not processed? That's not standard medical protocol. Thaler. She used my name for the first time, and something about hearing it in that quiet, exhausted voice made me stop. He needs to know that good things can happen again. That food can be a comfort, not just fuel. Please. I ordered the meat. The cub woke when the food arrived. He was tense, immediately scanning the room, but Kate's hand on his back kept him from bolting. You hungry? She asked him softly. His nose twitched. He'd smelled the meat. Kate took a small piece, held it where he could see it. It's okay, it's for you. The cub stared at the meat like it might bite him back. I realized with a sick feeling that he probably expected punishment for wanting it. Kate waited. Didn't push, didn't coax beyond that initial offer, just held the meat and radiated patience. Finally, moving like he expected to be struck, the cub stretched his neck out and delicately took the meat from her fingers. He ate it in one gulp, then sat frozen, waiting. Good, Kate said simply. Want more? She fed him piece by piece, small portions, lots of praise. By the 6th piece, the cub was leaning into her hand, the tension draining from his small body. He's not just eating, Coran observed quietly from the doorway. He's accepting care, acknowledging dependency. That's pack behavior. She's not his pack, I said, but the words felt hollow. Isn't she? The surgical suite was ready. By 0600 hours, I'd assembled my best team, all of them briefed on the situation. Everyone understood that the human stayed or the surgery didn't happen. What I hadn't anticipated was how the cub would react to the surgical suite itself. The moment Kate carried him through the doors, he started screaming again, that same horrible sound from the medical bay. Pure terror-given voice. Lights, Kate snapped. Dim them now. I complied. The harsh surgical lighting dropped to a softer glow, the cub screaming lessened but didn't stop. He was trying to climb Kate, claws digging into her shoulders, trying to get away from something we couldn't see. What's wrong? Karan asked urgently. What triggered him? Kate was turning slowly, her eyes scanning the room. She stopped, facing the surgical table. Restraints, she said. He sees the restraints. The table had standard medical restraints built in, soft, padded. Nothing like what had been used on him, but restraints nonetheless. We need those for surgery, I said. He can't move during the procedure. Then he won't move. Kate's voice was flat. Remove them, all of them. That's impossible. The surgical protocols. Remove them or we leave. I looked at Kieran. She looked at the cub, still screaming, still trying to escape. Something only he could see in his nightmares. Remove the restraints, Karan said quietly. We stripped the table bare. The cub's screaming faded to whimpers, then to that high questioning sound. Better. Kate murmured to him, see, no cages, no restraint, just us. She sat on the surgical table, the cub in her lap. How are we doing this? The sedative needs to be administered, I said, but given his previous reactions, show me the injector. I brought it over. Kate examined it, then showed it to the cub. This is going to make you sleepy, she said, so the doctors can fix your leg. It won't hurt, I promise. The cub made a small sound, something between a whimper and a question. I'll be right here, Kate said. The whole time, when you wake up, I'll still be here. She looked at me, nodded. I administered the sedative, expecting screaming, thrashing, panic. The cub watched the injector approach, looked at Kate's face and held still. The sedative took effect quickly. The cub's eyes grew heavy. He made one more small sound and Kate gathered him closer. I've got you, she whispered. You're safe, I promise. He fell asleep in her arms. We need him on the table, Karan said gently. Kate looked down at the cub, at the way his paws were still clutched in her shirt. Will it hurt him if I move him? We'll be careful. Together we transferred him to the table. Kate positioned herself at his head, one hand resting on his shoulder, where he could feel her presence, even unconscious. If anything goes wrong, she said quietly, if he starts to wake up distressed, you stop and let me calm him first. Understood? Understood, I said. The surgery took 2 hours. We had to re-break the improperly healed bone, reset it, stimulate the nerve cluster to prevent permanent damage. Delicate work made more complicated by the presence of a human civilian in a sterile surgical field. Kate never moved, never spoke unless spoken to, just kept her hand on the cub's shoulder, that steady pressure that said without words, you're not alone, you're safe, I'm here. Halfway through, Kieran paused to check the cub's vitals. His stress hormones are remarkably low for this level of invasive surgery. Even unconscious, he's registering her Presence as a calming factor. Physiologically impossible, I muttered. Sealing a nerve bundle, added to the list. We finished the surgery at Odo 820 hours. The bone was properly set, the nerve damage repaired, the prognosis good. The cub would have full function of the limb after rehabilitation. He'll wake in about 30 minutes, I told Kate as we moved him to recovery. He'll be groggy, possibly nauseous, disoriented. I'll be here, she said simply. She was. When the cub's eyes opened, unfocused and confused, the first thing he saw was Kate's face. He made a small distressed sound and she immediately started talking. You're okay, the surgery's done. Your leg is going to feel better soon, you're safe. The cub's gaze sharpened, focused on her, that high questioning sound. I'm here, Kate confirmed. I told you I wouldn't leave. The cub tried to move, discovered the bandages on his leg, and started to panic. Kate's hand pressed gently on his chest. Easy, don't move yet. You need to let it heal. She started humming, nothing I recognized, some human melody, soft and rhythmic. The cub's panic faded. He watched her face, listening to the sound, and slowly relaxed. Extraordinary. Corin breathed from the doorway. It was. All of it was extraordinary and impossible and completely outside every parameter of my medical training. This human shouldn't be able to do what she was doing. The cub shouldn't respond the way he was responding. And yet Kate kept humming that soft, nameless melody, and the cub's eyes drifted closed again. Not sleep this time, just rest, trust. We need to run full neurological scans, Dr. Thex said, appearing in the doorway with his entire team. Document the bonding mechanism. This could revolutionize our understanding of cross-species attachment theory. No, Kate said, not stopping her humming, not looking up. This is a scientifically unprecedented event. He's not a science experiment. Now Kate did look up, and her eyes were hard. He's a traumatized child who's been through enough. You want to study something, study why your protocols failed and mine worked. Your protocols? Dr. Thex sputtered. You don't have protocols. You're a wedding planner. Exactly, Kate said, and I just did your job better than you could have. Think about what that means. The silence that followed was profound. Finally, Dr. Thex turned and left, his team trailing behind him. Through the open door, I could hear him muttering about grant proposals and paradigm shift. You made an enemy there, I observed. Kate shrugged, her attention back on the cub. I've dealt with angry mothers-in-law. Xenopsychologists don't scare me. The cub made a small sound. Kate resumed humming. I stood there, watching them, this impossible pair, and felt something fundamental shift in my understanding of how healing worked. Maybe protocols weren't everything. Maybe sometimes what a patient needed wasn't the right procedure, but the right person. Someone who saw them as an individual, not a case file. Someone who offered safety before treatment, comfort before compliance. Someone who understood that the most sophisticated medical intervention in the galaxy couldn't compete with the simple presence of someone who cared. The cub sighed, settling deeper into sleep. Kate's hand never left his shoulder. What happens now? I asked. Quietly, Kate finally looked at me. There was exhaustion in her face and something else, determination. Now, she said, now we make sure he heals, all of him, not just his leg. The cub spoke his first words in weeks. On the third day of recovery, Kate was reading to him, not in standard but in that other human language she'd used before. I'd looked it up. Something called Spanish from Earth's historical records. The cub couldn't understand the words, but he listened to the rhythm of her voice, the rise and fall of sounds that meant safety. She just turned a page on the data pad when he made a sound that wasn't quite a chirp or a whimper. It was deliberate, shaped, an attempt at language. Kate stopped reading immediately. Did you just? The cub tried again. It came out mangled, his vocal structure not quite designed for standard phonemes, but the intent was clear. He was trying to say her name, Ka. Her eyes filled with tears. Yes, Kate. That's right. The cub made that high, questioning sound, then tried something else, a longer phrase still garbled, but I caught it. Pack mother. Kate looked up at me, her face stricken. Talrech, what is he asking? I felt my throat tighten. Pack mother is it's what Krethi cubs call their primary caregiver, the one who feeds them, protects them, teaches them how to survive. It's not just a parent. It's the foundation of their entire social structure. Kate looked back down at the cub. He was watching her with those two wide eyes, waiting for an answer that would shape his entire understanding of his place in the world. I don't know how to do this, Kate whispered. I'm not equipped to raise a Krethi cub. I don't even live on this station permanently. I was just here for a contract negotiation. The cub made a small wounded sound. He was picking up on her distress, her uncertainty. Kate's hand immediately went to his head, that automatic comforting gesture. No, I'm here. I'm not leaving. But she looked at me with something like desperation. What do I tell him? I should have had an answer, should have consulted the xenopsychology team, followed proper protocols for traumatized juveniles forming inappropriate attachments. Should have done something professional and measured. Instead, I said, tell him the truth. Kate took a breath, another. Then she looked at the cub and spoke slowly, clearly. I can't be your pack mother forever, she said. I have to leave the station eventually, but right now, yes, right now I'm here and I'm keeping you safe, and I'm going to make sure you heal. The cub absorbed this, then carefully he rested his head against her hand and made a sound that might have been acceptance. We need a transition plan, Karan said later, after the cub had fallen asleep. We were in my office. Kate slumped in a chair with a cup of stimulant she wasn't drinking. He can't stay this dependent on you. It's not sustainable. I know, Kate said quietly, but we can't just rip him away either, I added. Trauma would be catastrophic. Kate was quiet for a long moment, then she said, at weddings, when families are blended, when there are step-parents or complicated dynamics, you don't force instant bonds. You build bridges, small connections, gradual trust. You let people see that one person vouching for another means something. She looked up at us. He trusts me, so I teach him to trust you. I show him that the people I trust are safe, that when I say someone is good, he can believe it. Social transitivity, Karan said thoughtfully. If Kate trusts us and the cub trusts Kate, then the cub extends provisional trust to us. How long will that take? I asked. Kate's smile was tired. How long do you have? The answer turned out to be 2 weeks. Kate contacted her clients, postponed contracts, and stayed on station Havros. She moved into the recovery room with the cub and began the slow process of teaching him that the world could be safe, and she taught us. I watched her show Quran how to approach the cub without triggering his fear responses, how to read the subtle signals in his ear position, his tail movement, the pitch of his vocalizations, things that should have been obvious to trained xenomedicine specialists, but that we'd somehow missed in all our technical training. You're not looking at his medical indicators, Kate explained. You're looking at him, the person, not the patient. She taught our nursing staff her wedding crisis de-escalation techniques, how to stay calm when someone is panicking, how to offer choices instead of demands, how to validate fear while providing safety. When a bride is melting down, Kate said, during an impromptu training session I'd authorized, you don't tell her she's wrong to feel that way. You acknowledge the feeling, then redirect to solutions. Same principle. The cub started allowing Curran to check his bandages on day 5. He let me scan his leg for healing progress on day 8. By day 10, he was taking food from other staff members, though he always looked to Kate first for approval. He's learning social cues, Dr. Thex observed during one of his frequent visits. He'd gone from offended to fascinated somewhere around day 6. Watching Kate's body language to determine threat assessment, she's essentially teaching him how to evaluate trustworthiness. She's teaching him how to be a child again. Quran corrected, how to play, how to be curious, how to exist without constant fear. It was true. I'd watched Kate introduced the cub to simple games, to toys, to the concept that not everything was a threat or a test. She'd sit on the floor with him and roll a ball back and forth, and his confusion had been heartbreaking. He didn't understand play, didn't know what to do with objects that weren't weapons or cages, but he learned, slowly, carefully he learned. On day 12, Kate introduced him to other Creathi. We'd located a family on the station, refugees from the outer reaches who'd heard about the rescued cub. They came to the medical bay cautiously, unsure what to expect. The cub hid behind Kate immediately, but he was watching, curious. The Crevathi matriarch, a scarred female named Shivara, approached slowly. She spoke in the Crevathi language, low clicks and rumbles. The cub's ears perked up. She's saying he's safe now. Kate translated, though I suspected she was guessing based on tone that he's pack. The cub made a sound, a question. Shivara responded, then did something extraordinary. She lowered herself to the ground, belly exposed, in a gesture of absolute submission and trust. The cub stared. Then slowly he emerged from behind Kate and approached Shivara. He touched noses with her, the traditional Crevathi greeting. Shivara made a deep rumbling sound. The cub responded with a higher pitch. They're talking, I breathed. He remembers, Kate said softly. He remembers his language. We arranged for Shivara's family to visit daily after that, gradually, carefully building connections. The cub started spending time with the other Creathi juveniles, learning games Kate couldn't teach him, practicing language she couldn't speak. But he always came back to Kate, always checked that she was there, that she approved, that she was proud of him. On day 14, we held a meeting, Kate, myself, Karan, Vexmil, Dr. Thex, and Shivara. With a translator. He can't stay in medical indefinitely, I said. And Kate needs to return to her work. My pack would welcome him, Shivara said through the translator. We have 3 cubs already, 1 more. Would be a blessing, not a burden. Kate looked at the table. Will he understand that I'm not abandoning him? We'll make sure he understands, Quran said gently. Gradual transition, Yule. Visit video calls are maintained. Connection just evolving. Like a wedding party after the ceremony. Kate said with a weak smile, everyone goes their separate ways, but the relationships remain. We implemented what became known as the VAS method, a formal protocol for traumatized juveniles, establish safety. First, build trust through consistent presence, use trusted individuals as bridges to broader social connections. Never force compliance. Always offer choices. It worked, not just for the cub but for 3 other cases that came through our medical bay over the next month. Traumatized juveniles who would have been restrained, sedated, treated like dangerous animals. Instead, we found them there, Kate. Someone who could see past the fear and trauma to the child underneath. The cub moved in with Shivara's family. On day 17, Kate stayed for the transition, spending gradually less time at the family's quarters, gradually more time returning to her own work. The last day I saw them together, the cub was playing with Shivar's other cubs, roughhousing the kind of normal childhood chaos that seemed impossible 2 weeks earlier. Kate watched from the doorway, tears streaming down her face. He's going to be okay, I said quietly. I know. Kate wiped her eyes. That's why I'm crying. The cub looked up, saw her, and bounded over. He pressed his head against her chest, that familiar gesture, and made a sound that might have been thank you or goodbye or simply I love you. Kate held him one last time. You're going to do amazing things, she whispered. You're so brave and so strong, and I'm so proud of you. The cub chirped once, then bounded back to his new siblings. Kate left Station Havros the next day. She had a wedding to coordinate, some high-level diplomatic thing that required her specific expertise. I walked her to the transport. I forwarded the VAS method protocols to xenopsychology departments on 14 stations. I said, you've changed how we approach trauma care for juvenile patients across 3 sectors. Kate shrugged. I just treated him like a person instead of a problem. That's exactly why it worked, she smiled. Tired but genuine. Take care of him and tell Shivara I'll send video messages. I will. Kate boarded the transport. Through the viewport, I saw her pull out her data pad, already reviewing something, back to her normal life, coordinating flowers and seating charts and temperamental clients, as if she hadn't just revolutionized xeno medicine, as if she hadn't taught a station full of specialists that sometimes the best intervention is simple human compassion. My communicator chimed, a message from Kate's shuttle already departing. By the way, it read, the bridezilla just threatened to cancel the wedding because the napkins are the wrong shade of blue. If I can handle that after everything this week, I can handle anything. Thanks for the perspective, Kay. I laughed, couldn't help it. The human wedding planner who'd saved a traumatized cub rewrote our protocols and taught us all how to actually see our patients, was now dealing with napkin emergencies, and somehow that felt exactly